Hi, I have a general elderly question. My grandmother broke her hip recently, and she's in the nursing home now recovering. But my general elderly question is, how do you know signs of Alzheimer's versus like dementia? Because she's not really going home, but she thinks like she's gonna go make a TV dinner tonight, and she's still in the nursing home. So any comments and help on that?
As I said before, I'm the slacker up here. Alzheimer's is a disease that causes dementia. There are many diseases that will cause dementia, and there are many circumstances in a person's life, jump in any time if I misspeak, that will cause the onset of a dementia, a surgery, anesthesia, stress, all kinds of things. So I wouldn't panic that your grandmother, oh my God, she's got Alzheimer's. It may be a passing thing, it may be a treatable thing, or it may be a disease that has caused some dementia. And my advice to you would be to speak to her medical professionals, contact the Alzheimer's Association for assistance, and I can give you that information afterwards if you'd like. We do have a director here in the Leatherstocking region, loads of services available through that association as well.
I have to say, Carol's no slacker, so.
I was just going to make one general comment that sometimes the conversations are difficult because there's ambiguity on what the patient wants, and there's too much information. And I think it's really important that you come back again and have another conversation, because that's really very stressful I can tell you, it's very stressful for the physician, because people haven't thought out where they want to be or what they want to do, and then you may be giving them a lot of information regarding prognosis and options and such. And that's the time to really come back in like a week or so and have another conversation with that person. Because I can tell you, on the physician side, it's equally uncomfortable for them as it is for the person receiving that information. And so an early follow-up conversation is really, I think, very important.
Regarding your grandmother, if she's becoming more confused after her surgery, it may be that she had a mild dementia. What we see a lot of times is someone will have a mild dementia, but they're functioning at home, and they're doing really well with their daily routine, and they're in their own home setting and all their familiar surroundings, and then when we take them out of their familiar surroundings, they decompensate, where that mild dementia becomes more noticeable. And a lot of times people tell us in the hospital, this has never been a problem. She's been sharp as a tack this whole time, and then I'll ask, well, you know, does she always make Thanksgiving dinner? And they'll say, well, not last year. She's been, you know, she wasn't up to it last year. Or we'll try to tease out and sort of help them understand that she may have been slightly demented before. A lot of times the patients will have a multi-infarct dementia, lots of little tiny strokes that'll accumulate and finally have enough of an insult where they're more forgetful, especially if that's occurring after a surgery. We see a lot of just a change in IQ for a lot of the elderly patients after they've had anesthesia, and but that would be just an idea, something to think about. One of the things that happens though is when you're in the hospital or after you're out of the hospital, after you've had a hip surgery, a lot of times we give you different medications for different reasons, and it affects your cognition. So all the narcotics that we give you for pain and the benzodiazepines we give you, you know, like the Valium type medications to calm you, and then the atypical antipsychotics we give to help reorganize you to go to bed. And you know, a lot of times these things, they're all fat soluble, so a lot of times we end up pickling you, and it takes a while to wear off. As far as dementia goes, dementia when it's pleasant, when the person isn't confused, when they're not scared, when they're not trying to figure out where they are, dementia is quite pleasant for a lot of patients in the hospital. Imagine.
That needs explanation.
Oh, I'm going to. Just imagine if you have lived in your own home for so many years, and every day you've done your own laundry, and you've done your own bathing, you've made your own breakfast, and suddenly you're suffering with pain, you're in a nursing home, and every time you move your hip hurts, and you have to ask everyone to do things for you. If you're slightly forgetful, and you're going to make a TV dinner tonight and you forget for a short period of time that you're in a nursing home, I think that's great. I mean, and I also think it's frustrating for the patient if you keep reorienting them and saying, no, you're not in your own home, you're not in your living room, you're in the nursing home. Like, I don't know, like, just stop being a wet blanket and just leave them alone and just, I don't want to get in trouble here, but, you know.
No trouble to be found here.